Hello, everyone. Hello, and welcome to tonight's or early evening's webinar presentation on cat health and nutrition. This is Dr. Andrew Jones. Hi, you guys. Hope you're all doing well. I'm just getting myself set up here. Hopefully, I got the webinar looking good. We're actually testing the software is a little bit different that I've never used before. So I'm hoping you can hear me and it all looks good. I see you guys are chatting in the window, so I think I've got everything. I'm making sure I've got the microphone turned on. You guys should be able to see the PowerPoint now. Just hi. You guys are, so first of all, if you feel free to say hi or hello. Hi, Pam is from Australia. Well, hi, Pam. I can't imagine what time it is there. Heidi's from San Francisco. Hi, Heidi. Hi, Terry from Wisconsin. Hi, Margaret from Ottawa. And Teresa from Florida. You guys are from all over. Wow. Diana from Minnesota. Donna from Connecticut. Wow. Ernestino says hola. So I'm thinking that's someone from potentially even Mexico. Wow. Hi. Hi, Annette from Las Vegas. Perhaps we might even have some Canadians. That's awesome. Yay. And Margaret says, yes, we can hear me. That's awesome. Great. I'm glad you can hear me. Thanks, you guys. First, thanks for being here tonight. I am going to be covering a whole pile of information. I think I may even have a slide on that, but there is lots of stuff to cover. So don't feel as if you're going to be overwhelmed with it. You're all going to get a recording. We're recording the slide and you're all going to get a copy of it. Oh, Jose says hi from Tijuana. Hi. Hi, Nancy from Georgia. Hi, Anne from Ontario. Hello, fellow Canadian. Yay. Hi, and Isabel from Quebec. Hi, Isabel. Hello, you guys. Wow, thanks you guys for all being here. That's awesome. Hi, Jody from Vancouver. Oh my God, someone's almost in my own backyard. Hi. First, thanks for being on the presentation tonight. And as I'm saying, we're covering a whole pile of information, but you're going to get a recording of it. Hi, Barb. Hi, Julia. Hi, Susan. Hi, Peggy. Oh, there's a whole bunch of Ontarians are chipping in. Hi, you guys. Hi, Jan. I know who you are. Hi, Jan. I hope you're doing well. So as I said, we're going to be recording all of it. So don't feel free, if you're like, oh no, I'm going to miss this little bit. You're going to be recording of it. I'm going to hop right into the presentation just because we're covering so much. So as I said earlier, welcome to the webinar on how to keep your cat healthy with food and at-home remedies. And as I've been saying, I'm covering lots and lots of information. So a couple big things. First of all, try to be as distraction-free as possible, especially now. It's pretty difficult. So shut all that things off and the buzzers and the ringers, etc. And I also say be ready to take notes. But even I think more than that, just think about sort of, 4 or 5 things. I mean, anytime you do any type of presentation, often there's so much information. Just think of sort of 4 or 5 nuggets of information that you're going to take out of it that you could potentially, use with your cat within the next week or the next month. And that's probably more helpful than anything else. So you actually don't try to remember all of it, learn all of it, just sort of 5 specific things that's going to be applicable to you. A little bit about me, for those of you who don't know me, I was born and raised on a farm here in British Columbia, Canada. I grew up reading James Herriot books, which are great books if you guys have yet to read them. He's just about the life of a mixed animal veterinarian in rural England, and he's also a wonderful author. And no question that, and in part of growing up with animals, and that was kind of my, my thing and my calling. I mean, that really did inspire me to become a veterinarian. Believe it or not, even at that age with those styling shorts, I decided then I'm going to be a vet when I grow up. I graduated with my DVM from the University of Saskatchewan in 1992, and until fairly recently, I've been practicing as a small animal veterinarian. I have had no question, I have a special interest in alternative non-traditional remedies for pets. And, I've published a number of, obviously, things related to that. This daily newsletter, numerous digital books, articles, reports, home study course, an online pet health member site, as along with developing a complete nutritional supplement for cats and dogs. A few years ago, I was featured on ABC's News Show 2020. So after the presentation, you can Google that 2020 and see me speaking. And yes, that really is me. And a few years ago, I also released my first sort of quote-unquote real book called Veterinary Secrets on Amazon in 2014. And that's myself pictured there in the middle with my former cat Cleo, Lewis on my former dog Lewis on one side, and then our Lewis's buddy Pearl on the other. And before I get right into the presentation, just wanted to, this has sort of been the last cat that's been in our house. Unfortunately, I had a couple of older cats, and my last cat, Gussie, she died in December. Too bad. And our dog Lewis, who was there in the Black Lab, he died in January. So I've been petless, but not been petless in terms of all these friends that travel and go away, and can you house sit? So this guy was just house sitting over at our house. His family was away during spring break. Yes, he's very mischievous. I was just saying to my brother, he was like his unique personality. So he'd hide in one corner of the room, and as soon as you walk by, he'd attack you. But he also had this little stuffy pillow thing that was his substitute. We think he was weaned early as a kitten. So as soon as he was sort of losing in on you, you could throw him his little stuffy, and he'd stop doing whatever he was doing so he could go nurse on his little stuffy. Cats are very unique creatures. The incorrect assumptions of feeding cats that are causing health problems. Here's what you need to know about cat food to prevent and treat common cat diseases. No question, much of what I was taught as a practicing veterinarian, and more specifically about feeding cats, both for the prevention and treatment of disease, really has been shown to be false. Our cats are obligate carnivores, meaning they need animal protein to survive. And many of the common cat diseases are directly linked to our incorrect assumption of feeding cats the same way we feed dogs. The cats, they evolved over millions of years into carnivores with this unique ways to utilize the food that they hunt. Such as how they utilize that protein, the fats, the vitamins in their prey. Think about what they eat in the wild. It's lots and lots of protein, a fair amount of fat, virtually no carbohydrate. They're hunting birds, mice. And really this core concept should be at the forefront of cat nutrition and disease. They require much higher protein than dogs. Adult cats need 29% protein in their diet versus the adult canine minimum requirement of 12%. It's a huge difference. Cats evolved as animals with very poor triggers for thirst. They're not accustomed to drinking. And in the wild, they would get most of their water from their prey. Canned food is much more similar to their natural, quote-unquote, natural diet, as it provides a lot more water, 60 to 70% than dry kibble does, which is virtually zero. Smaller frequent meals. Cats are adapted to eating multiple small meals throughout the day and night. A cat in the wild, he or she may eat up to 20 small meals a day. And cats are also very sensitive to the feel of the food, the smell of the food, how it tastes. So it's not just... because unfortunately what happened as veterinarians, we were just taught a cat, small dog. Completely not true. Most cats prefer foods that are like flesh, moist, solid, and warm. So in taking that all in, that before I get into some of the diseases and some of the remedies, it's just really seeing that it is really different in terms of how they have historically adapted and evolved into the animals that they are today. So we really need to approach them different in terms of how we feed them, and then how we treat they're sort of very unique. Some of the unique diseases our cats get. A little bit about kidney failure in cats. So common. And really, you should be focused on lowering this one ingredient, and no, it's not protein. He's an older kitty. She's probably got kidney failure. So some of the signs: your cat is drinking more water, urinating more often. He or she may be losing weight, specifically loss of muscle mass as the kidneys lose protein. As kidney failure advances, your cat may become very weak due to anemia. Your cat's going to have a decreased appetite due to a buildup of certain toxins in the bloodstream, urea, creatinine. In advanced cases, he will become dehydrated and completely off food. And in some pets, kidney diseases causes elevated blood pressure, which can affect their eyesight. So some of these guys actually will go blind. But if your cat has kidney failure, so one of the first big indicators, you go to see the vet, because my cat's drinking more water. Many and probably most veterinarians still are going to advise that you place your cat on a pretty strict low protein cat food. Yet to date, there's no studies 100% showing that restricting protein is going to prevent further deterioration of kidney function. Yes, it's going to prevent urea creatinine from building up, but that's especially only really important in the really advanced cases, not early on. In fact, some of the veterinary cat specialists are now advising to not restrict protein. They're advising to maintain protein levels and restrict phosphorus, the nutrient in animal protein that is damaging the kidneys. There, a little bit about water. Fluid. The most important thing that you can do for your pet with breathing failure is to maintain adequate hydration. Offer lots of fresh water. If your cat is not a great water drinker, and I think in all cases of kidney disease, you should be switching your cat to canned food. Probiotics. There's one probiotic called Azadil, sold through veterinary practices. I see it's now available on Amazon to you as a cat owner. It's a natural probiotic which metabolizes and flushes out uremic toxins in the bowel. And so these probiotics are slowing down uremic toxin build up in the blood, helping to prevent further kidney damage. The Azadil dose is 1 capsule per 10 pounds daily to a maximum of 4 capsules a day. Phosphorus reduction, which is the one we've been talking about all along. So in the early stages of kidney disease, this is the mineral which is damaging the kidneys. It's phosphorus. It speeds up destruction of the remaining kidney cells. So what you want to do is feed a diet lower in phosphorus and also use phosphorus binders. So this is one specific phosphorus binder. It's called aluminum hydroxide, or ALOH. It's odorless, tasteless, and can be mixed with food. So it needs to be ministered with food. So you'd be mixing it in with your cat's canned food. The pretty standard dose is of 1/4 teaspoon per 10 pounds daily. Or you could also consider this, calcium carbonate or Tums. So it's another fairly safe, effective treatment. And the dose is 1/4 650 milligram tablet, and per 10 pounds, which is your standard cat's weight, per 10 pounds of body weight, once or twice daily. Cat urinary tract problems. Do you need expensive prescription food? But some of the holistic solutions that can work to stop your cat's urinary tract infections. So here's a kitty who unfortunately is obstructed and is in the process of being unobstructed. A male cat who actually has a plug or urolith. A little bit about FLUTD, feline lower urinary tract disease. Some of the clinical signs: your cat will be frequently urinating, straining to urinate. He or she's going to likely have bladder pain, excessively licking their genitals, and often there's blood in the urine. Sometimes they'll urinate outside their litter box, preferring cool, smooth surfaces like a tile floor. The disease is so named idiopathic because we really don't know all the underlying causes. There's marked inflammation of the bladder lining is thickened, and the result is blood in the urine. Some are related to diet. There may be bacteria or viruses that affect the bladder. The immune system may overreact and attack the lining of the bladder, or it can simply be a response to stress, such as having another cat, not letting your cat go outside and have all these. And the symptoms, the sign and symptoms are then showing up in the urinary tract or in the bladder. Whereas in the past, we thought that's impossible. When I first graduated, which wasn't that long ago, though it does seem like a while ago, there's no way they would have imagined that stress would lead to FLUTD. We're just told it's about the ash. It's whatever's in the diet. You got to eliminate less ash. So feed these better low ash cat foods. They're still dry cat foods, and your cat's going to be fine. But not the case. So the first thing, you got a cat straining to urinate and they're not producing any urine. You need to see a veterinarian as soon as possible, especially if you've got a male cat. They can be completely obstructed with a urolith, some type of stone, and they're going to need to be what I showed in that picture. They need to be sedated. They're going to need to have a catheter passed to be unblocked. It had happened in a pretty quick period of time. Regardless, it's always a good idea just to have the urine checked for any urinary tract problems. So then at least you can get a diagnosis, and then you're able to at least use the appropriate remedy, knowing what the specific problem is. So in all cases of infections or stones, additional fluid intake is mandatory in both the treatment and preventing recurrence. In other words, just feeding only canned food. For most cats, any type of quality canned food will be helpful, not just the veterinary foods. So more importantly, what's happening is that virtually all foods, just to be in a canned consistency, they're higher protein or high protein. And the high protein itself produces a slightly acidic urine, and the canned food dramatically increases fluid to flush the bladder. And that alone is just so therapeutic, that additional fluid. There's some natural hormones or pheromones, and they're ones that, that's when a cat is happy, that's what they're releasing. So there's a product called Feel Away. It's also through your vet, also now available through Amazon, I see, which contains these, happy facial pheromones. So you can get it as a diffuser where it's being released in your house. I had a lot of clients say their cats responded well to that. Also, you can get it as a spray. We're going to spray it around. What we're trying to do is decrease anxiety, make your cat feel that much better. And by doing so, decrease the likelihood of this FLUTD that's recurring over and over again. Natural anxiety relief would be Bach Rescue Remedy. It may make your anxious cat feel calmer and more secure. The dose is 1 drop twice daily in your cat's mouth. You can try it for 3 to 4 weeks, seeing if it's being beneficial. A couple of homeopathics. One is aconite, best if early in the disease with a few other clinical signs. I've written 12C, but it should be 2 30C tablets 2 to 3 times a day. And the other one is pulsatilla. It's going to help when there's more recurrent cases of bladder infections or these FLUTD bouts. The dose, once again, I put 12C, but the easiest would be to get a 30C dose, 1 30C capsule twice daily. Glucosamine and chondroitin, 2 pretty important supplements that need to be discussed. Glucosamine is anti-inflammatory and rebuilds the damaged bladder lining. Chondroitin helps prevent the wall from being broken down. The glucosamine dose, 100 milligrams per 10 pounds of body weight daily. Chondroitin dose of 50 milligrams per 10 pounds of body weight daily. So the last big thing with these guys with FLUTD, because I saw hundreds of clients with cats that had this issue, is, initially, we would often think these guys had infections, bacterial infections. So we would do urinalysis. For the most part, if someone who is taking an appropriate urine sample, they're not going to see bacteria. Virtually no cats have, very, very few to none. They say it's less than 5% are going to have bacterial infections causing a bladder infection, where dogs do. So it's really, really different that way. I used to, though, in practice, we would I would have maybe even sent you home with some antibiotics. We now know that's not really needed. For the most cases, most of the time, it's a matter of you getting your cat on the appropriate diet, making sure they've got lots of fluid going through them, looking at ways to decrease their anxiety. And if you give them some type of supplement, such as glucosamine, chondroitin, then you can actually go a long way in terms of prevent this thing from coming back and back and back again. Hyperthyroid cat, are there any holistic options? Another great question. There I am palpating a cat. I'm just showing you where the thyroid gland is located. It's along either side of the trachea or the airway. Causes of hyperthyroidism are unclear, yet the effect of diet on the thyroid gland is considered one of the major suspects, such as soy. It's a relatively new disease linked to dry, high-carb kibble and chemicals in cat food. Pretty typically, we're going to have a cat that's over the age of 10, increasing appetite, but they're losing weight. That's probably the single biggest thing. My cat's eating everything in sight. She's not gaining weight. Sparse hair coat, urinating more often. There's evidence of obvious muscle loss. And in some cases, you're able to feel an enlarged thyroid gland beside her Adam's apple, which showing me palpate there. Her heart rate is generally elevated. I put greater than 200, usually greater than 240 beats per minute. First thing is obviously seeing your veterinarian. If you've got an older cat showing some of these clinical signs, you want to have your vet perform blood tests and confirm hyperthyroidism. Some cats may already have pre-existing kidney disease, and in those cases, we may not be able to treat the thyroid condition. But a simple blood panel with a T4 test is going to confirm the disease. Pretty easy one to confirm. Some other holistic options. First, there's one called carnitine. It's a supplement that is found to be effective in reversing the signs of hyperthyroid disease in people. The starting cat dose is 250 milligrams a day. A couple of herbs, bugleweed and melissa, and I've had a couple clients respond saying they really help them. These two herbs have been used in combination to combat the effects of hyperthyroidism. Bugleweed has been shown to decrease thyroid hormone levels in rats 24 hours after administration. The standard dose is 1 drop per pound of body weight of the tincture is given twice daily. There's a product made by Hills called YD, which I have many pet owners write in, many cat owners such as yourself ask about. It's formulated to be deficient in iodine with the simple goal of providing less building material for the cat's thyroid tumor and normal glandular tissue. So the idea, if we completely eliminate iodine, we can decrease, the size of that thyroid tumor, which is pumping out all this excess thyroid hormone. But there's problems with that. So this Lisa Pearson, Dr. Lisa Pearson of catinfo.org said, I would only use this diet if 1, radioactive iodine was not available or the client could not afford the treatment, or the patient was not a good candidate for surgery, or the patient had shown an intolerance to transdermal methimazole. So that medication is called Tapazole, and it's one which I use quite often in practice. But lastly, she's saying, in other words, I see YD as a very, very last resort and certainly not a first-line treatment. So being especially cautious about it, because what it's doing is it's putting your cat into a state of iodine restriction, which can affect other parts of their body. They need iodine to function. Supplements, are they really necessary? No. In fact, if you feed your cat a varied diet with whole foods such as fish, raw food, flax oil, etc., they may never need a supplement. But most of us don't regularly do this, and I am of the strong belief that the right supplements can help prevent many of the more common cat diseases. Commercial cat food, it doesn't contain all the nutrients for your cat to thrive. Think about shopping in the grocery store. Can you get all of your nutrients in a bag? Let's use your cat's immune system as an example. There are a number of specific ingredients that I advise clients to give to boost their cat's immune system. Essential fatty acids, probiotics, antioxidants, zinc, flavonoids, selenium, colostrum, the immune supportive mushrooms, L-lysine, and aloe. My supplement, Ultimate Feline Health Formula, contains these immune supportive ingredients: probiotics, antioxidants, zinc, selenium, colostrum, the immune supportive mushrooms, lysine, and aloe vera. So as part of this webinar, I'm having a big special. It's 70% off my supplement, Ultimate Feline Health Formula, being offered for only $9.97. The regular price is $32.97 plus shipping. And plus, if you order in the next 12 hours, you're going to get 2 additional free bonuses. First, a copy of my best-selling book, Veterinary Secrets. It's now being sold for $29.97. Plus a copy of my book, Home Diets for Pets. It's being sold for $19.97. So after the presentation, you can go to thecatsupplement.com/special. The unique metabolism of your cat. Why carbohydrates can be harmful. We sure get lots of questions about these. Although cats can use carbohydrates as an energy source, they have no need for them. As I talked about earlier, our cats, they evolved by hunting other animals, high protein, high fat, minimal carbs. They're designed for high protein metabolism and low carb metabolism. Cats lack an enzyme called salivary amylase, further evidence that they're not designed to digest carbohydrates. They have only 5% of the pancreatic amylase and only 10% of the intestinal amylase of dogs. In other words, they virtually don't have any amylase. Yet here we are, formulating dry cat food diets, much the same that we formulate for dogs. Cats get far more of their energy from protein than most species. They have a very short colon, which limits their ability to use starches and fibers through bacterial fermentation. This is seen in us, in animals such as dogs, horses, etc. Cats lack a liver enzyme called glucokinase. This is used to break down blood sugar, glucose. Glucose becomes markedly elevated after a large carb meal, but our cats lack the ability to rapidly break it down. This has direct implications with diabetes. All of this blood sugar then overwhelms the pancreas, and then your cat's pancreas can lose its ability to produce insulin. Hence, we have a diabetic cat, which is huge when you really think about it. And it's hard to believe. Just think of the millions of cats that are eating primarily dry kibble, and we're still starting them out on that. Exactly how to choose a quality cat food. Good question. So what are most cats fed? Dry kibble with no water, foods with far too high of a carbohydrate level, the wrong type of protein at too low of a level. A little bit about looking at cat food ingredients. First, the top 5 ingredients usually comprise 70% or more of a dry pet food's entire formula. First ingredient is more important because there's more of that than the other ingredients. All cat foods, they must list the ingredients in order of weight. My advice is to have an animal-based protein first. But obviously this changes based on the moisture content of the nutrients. The product form, is it meat meal versus chicken meal? Meat meal is a poor quality protein. Chicken meal is actually fairly good. And the real percent of that ingredient in the food. So what I mean, for instance, is you might be looking at a bag where they've got the first ingredient says whole chicken, and the second ingredient says, say for instance, it has cornmeal or something in it. And you'd think, oh great, it's got a protein as the first ingredient. Yeah, the problem is that when they're actually listing the ingredients on a pet food bag or pet food label, they're listing it as it's being added before it's been dried out. So if it's say a dry kibble, for instance, once they take away 80% of that whole chicken was actually water. Once they remove 80% of that water, the chicken really is probably 3rd or 4th on the ingredient list. So that's just sort of some of the lesser, the word is unscrupulous, but perhaps the ones that are maybe trying to sell you more food and not being really truthful can sort of play around with the label, which can make it more challenging to read and get a better sense of. One of the big tips is starting to look for the first name source of fat. So anything listed before the fat source and including it make up the main portion of the food. That gives you a pretty good idea. And then a little word about ingredient source. Support companies with good track records of producing healthy food, companies which have strict quality control, and those who have shown that their food is nutritionally sound, producing healthier cats. Some good common sense stuff. Like really going with reputable companies. You're going to probably have to pay a little bit more for your cat's food, but you can at least know that what you're feeding is actually healthy and it's going to help your cat. So what makes a good cat food? As I said, it doesn't need to be quite as complicated as many food companies and vets would have you believe. Just think of something really simple. Like, how do you keep this little guy healthy who's so cute? So real meat, such as chicken, lamb, beef, deer, fish, poultry is the primary ingredients. High quality, highly digestible protein. And just super key because we know our cats are obligate carnivores. That's like the basis. And just thinking about what your cat eats in the wild. Lots of protein, lots of fat, virtually no carbs. And as I said this earlier, they need 29% protein in their diet versus the adult canine minimum requirement of 12. And then minimal to no carbs. Yes, they can use them, but they've evolved not to use them. You also want to see that the food has some of the essential plant nutrients. Hopefully additional antioxidants and enzymes, plus natural vitamins, minerals, and fibers. Quality cat foods, they're going to list sources of fat that provide the proper balance of the omega-6 to the omega-3 fatty acids. So the omega-6 are the ones that aren't necessarily therapeutic or beneficial. The omega-3s are. Ideally, we're looking at a ratio of 2-to-1, not the 15-to-1 currently linked to cancer, heart disease, autoimmune disease, and skin disease. A little bit about my advised commercial cat food list. It's a list of some of the quality commercial foods that I'm comfortable advising you feed. There are others, and there's lots of regional ones. It's hard to get. So here is the list, but these are ones that I'm comfortable having you suggest that you have a look at. Artemis, Esmira, Back to Basics, Blue Buffalo, Canny Day, Champion Pet Foods, First Mate, Flint River Ranch, Halo Pets, Holistic Blend, Honest Kitchen, and Life's Abundance, Nature Pets Products, Nature's Logic. And for the 3rd year, Nature's Logic is featured on Susan Thixton's The List of Best Pet Foods. Nature's Variety, Pet Curie and Pet Nutrition, which includes Go Now and Summit, Solid Gold Health Food for Pets, and Timberwolf Organics. And you guys are going to, oh, and a few more here. So I forgot Versus Pet Foods, Vion Pet, Wellness, which I used to use a fair amount in practice, and then Wysong, which had lots of clients on Wysong. That's my now finally complete list. And you're going to get a copy of this, you guys. And then, when I'm coming to say like, oh, so what is the food you should be eating? Well, looking at canned food, such as this Go Natural one. High protein, low carb, high moisture content. So much better for your cat than the kibble that we have most cats on now. Cancer in cats. What can you give to help? Well, the first thing is trying to avoid cancer in the first place. So thinking about what are some of the potential carcinogens, such as herbicides, pesticides, smoke, artificial color, flavor, poor quality foods. Us using too many vaccines. The excessive use of conventional medication. Think about all those first. For instance, here's a cat that has feline fibrosarcoma, more than likely from a feline leukemia vaccine given up in between the shoulder blades. And it's such a challenging cancer because what happens by the time it's diagnosed, the cancer spreads these long tentacles, so it's virtually impossible to remove it with surgery. Look at adding some of the anti-carcinogens. Those are found in fresh fruits, vegetables, nutrient-rich protein sources such as salmon, healing fibers such as in ground flax seeds. Things that are going to help protect against cancer forming in the first place. The antioxidants, they've been shown to slow the growth and spread of some types of cancer, such as vitamin C, vitamin E, and selenium. The vitamin C dose, 100 milligrams per 10 pounds of body weight daily. Vitamin E, 100 IUs per 10 pounds of body weight daily. And the selenium dose is 25 micrograms per 10 pounds of body weight daily. Essential fatty acids, they really are essential. The omega-3 fatty acids, they're great anti-inflammatories and have been shown to prevent the spread of some types of cancer. Fish oil is the best source for cats, but flax oil is also effective. The big thing, you need to be using high enough therapeutic doses, which is 1,000 milligrams per 10 pounds of body weight daily. Some of the immune supportive supplements, such as probiotics, antioxidants, zinc, flavonoids, selenium, colostrum, the mushrooms, certain amino acids, such as L-lysine, arginine, aloe vera. A little bit about home diets for pets. That's a great shot. This is one of my weight loss diets for cats. So the big thing here is we're looking at primary proteins. We've got 80% poultry or egg, 20% veggies. We don't have any carbs in it. So this would be recommended for cats that are overweight, have diabetes or pancreatitis. 250 milligrams of calcium, a pet vitamin Theragrain or human multivitamin, half a tablet, a half to 1 teaspoon of fish oil, and 500 milligrams of taurine. You're going to pulverize the vitamin mineral tablets, mix them well with the remaining ingredients. It can be stored in the fridge. If warming with the microwave, be careful to avoid hot spots. The cancer diet for cats. So the big thing here is we're looking at high protein, and this one is using lean ground beef, 1 pound, a third of a pound of beef liver. We're using a vegetable oil, 4.5 tablespoons, plus 9,000 milligrams of fish oil. That's 9,000 milligram capsules. Calcium carbonate. You can use Tums with calcium, potassium chloride, which is a salt substitute, and giving your cat additional potassium. A third of a teaspoon of that, plus the adult multivitamin, 1 tablet. And once again, you're going to cook the rice, cook the ground beef, drain the fat, cook the liver, or dice it finely into small pieces. You're going to pulverize the calcium carbonate, the vitamin mineral tablets, mix the vegetable oil, fish oil, break open the capsules and the supplements with the rice, then add the cooked ground beef and liver. Mix well, cover, and refrigerate. Feed about a quarter of this mixture each day to a 10-pound cat. Diabetes in cats, the cause and surprising natural cure. Hope you guys are doing okay. Thanks for being on the webinar so far. I know I'm kind of zooming through. I looked at it just before I got onto the webinar. I had a quick chat with Michael. Said I have over 200 slides. We're covering a lot of stuff, but you're going to get, as I said, you're going to get a copy of all the slides too. So this is where the pancreas is located. That's what I brought it up here too. So you can see it up in there. It's sort of wedged in up behind the stomach, along the duodenum, the first part of the small intestine. Diabetes. It's a result of the pancreas not producing enough insulin to allow your cat's body to use blood sugar. And you have increased sugar resulting in the clinical signs, increased drinking and increased urination. We talked about this earlier. Sugar becomes markedly elevated after a large carb meal, but your cat lacks the ability to rapidly break it down. They don't have glucokinase. And here we are designing cat foods that do this. And no question is having serious implications for the increased incidence of diabetes in cats. We just keep flooding your cat's blood with sugar. They can't break down fast enough. We overwhelm the pancreas. Sort of makes sense, right? You can only run your car so long without oil, and then it's going to break. So what do you do? First, if you suspect your cat is diabetic, they're drinking excessively, urinating excessively, they seem sick, they need to be diagnosed first. And most cats need to start with insulin. But many are able to come off with some, especially if we look at modifying the diet, look at some of these remedies. Ask your veterinarian about glargine. The brand name is Lantus insulin. It's a longer acting and seems to work a little bit better at regulating difficult to regulate diabetic cats. Some of the dietary changes for cats. Big thing is changing to a less than 5% carbohydrate, high protein canned cat food. Very the single most important change to make. That's it. Just cut them off a kibble. You might have to do that over the next 3 or 4 weeks. You may not be able to wean them off immediately, but really look at getting completely off kibble, just onto high protein preferably good quality canned cat food, such as well as chicken or turkey, for instance, or Nature's Variety Organic, or some of the raw frozen diets. And as I said, it gives your cat the greatest chance of coming off of insulin. I was finding when I left in practice that almost 50% of the diabetic cats were able to be controlled just with diet. Fish oil, once again, is a source of omega-3 fatty acids. They may increase insulin sensitivity. You're looking at a feline dose of depending on the capsule concentration. Ideally, you're feeding 1,000 milligrams per day. Cinnamon, it's a tasty spice which has been shown to help you regulate blood sugar. It's also a potent antioxidant. The active ingredient in it that does that is called MHCP. It mimics insulin to improve blood sugar regulation. The dose is 1/4 teaspoon per 10 pounds daily. You're a limping, painful cat. What are some effective at-home remedies? Well, here's an x-ray just showing you what arthritis looks like. So you've just got this new, you can see sort of swelling, there's this new bone production. And it's just common. We age, our cats age. They lose that soft protective cartilage that's along that keeps the joints moving smoothly. And I know I've got some of it now with my knee crunching. But food has a direct correlation to it. In general, the more overweight our cats are, typically those guys on those high carb diets, those guys have more severe arthritis. So what can you do to help? First of all, you need to look at supplementing with glucosamine, chondroitin, MSM. But glucosamine for sure. Probably the most important supplement to add. And I just found so many cats responded well to it. It's just because the other issue with our cats is we can't really give the non-steroidal anti-inflammatory drugs. Even though some are on them, those are only meant sort of for short-term things, never ongoing long-term. Because so many guys can react to them and ultimately affecting their kidney, putting them into kidney failure and or affecting their liver. So you want to be looking at the supplements of things that are going to be safe for your organs in the first place. Glucosamine dose is 1/4 of a 500 milligram tablet once daily. And they can be on that long term. No real side effects. It helps rebuild the cartilage to delay further cartilage breakdown. Chondroitin, it's another key component of cartilage. It works in conjunction with glucosamine. And lastly, there's one called MSM, and it also works in conjunction with glucosamine and chondroitin. The three of them work really well together as sort of anti-arthritic, cartilage-supporting supplements. The omega-3 fatty acids, which you hear me talk a lot about, pretty key for our cats. They respond really well to them, especially the fish oil. the big thing and the big point you need to be taking away from it is making sure you're giving a high enough dose. So typically, you need to be giving upwards of 1,000 milligrams per 10 pounds daily. Acupressure. It's an overlooked and often effective option. I'm surprised how many guys respond to it. In truth, I tried to do some, and it also depends on the cat. So my last cat, Cleo, who was the orange guy pictured in my book, he did respond somewhat to acupressure, and he was more open to me doing stuff to him. Or my last cat, Gussie, not so much. She's like, Nyeh. I would try some of this stuff for her, and her ears would go back, and she'd give me that growly look and then swat at me. So assuming your cat is open to this, but you can start with something simple like the ear. The ear, it's a microcosm of the energy pathways in your pet. You can just perform gentle circular motions on the top and side of the ear, and this stimulates the back legs. The couple big easy ones to find: BL60, KI3. So the outside of the hock and the inside of the hock joint. So if you just grab your ankle, right up from your ankle is that big tendon called the Achilles tendon. There's a flap of skin between the Achilles tendon and the bone, between the tibia. And the BL60 is on the outside, and the inside of that is called the KI3. So you can put your thumb on the outside, your forefinger on the inside. Just do that with your cat too. It's thought that the BL60 is known as sort of the aspirin joint. It's a real key one for taking away pain and inflammation. The KI3 one is one it's said to tonify the qi. It's kind of the whole basis of Chinese medicine and part of the principle of using acupressure in the first place. The GB29 and GB30 points, they're really important. We've got these sort of guys are really hiking their back legs up. They probably have hip dysplasia. And so to find those, you just run your hand along the outside of their leg. The bone on their back leg is called the femur. And there's a point that sticks at the top of that femur called the point of the femur. The GB29 and GB30 points are sort of depressions on either side of that little point of that bone. You can use your two middle fingers, your thumb and your forefinger. And when you're using acupressure, you're indenting the skin just enough. Not that it's painful, but just enough of an indent. And then you're holding that for 30 to 60 seconds. And then you're releasing. And I always suggest to do it twice a day. Do it for a week. See if it's beneficial or not. This is just showing a slide. That was one of my last hospital cat, Mischief. Showing where some of her stuff is located. There's GB29, GB30. The one other point I need to make is I do have a big YouTube channel called Veterinary Secrets. So after the webinar, you guys can also go onto YouTube and just go Dr. Jones Acupressure, or you can probably even put it into Google and find that Dr. Jones Acupressure YouTube, and up I'll come. And you'll see me also demonstrating those specific acupressure points. Homeopathic rust hawks, great. You've got these pain stiff guys, and they're like, and you want to think of something soft tissue wise. What else could I use? You could use rust hawks. The dose is 130C capsule twice daily. Once again, try it for 1 to 2 weeks. See if it's helping your cat or not. It can also just be used short term. You've got an acute injury, like, oh, my cat's really painful. Say he was in a fight. You can use it every 2 to 3 hours and just use it for 1 to 2 days. Some of the foods that are hazardous to your cat. Fortunately, our cats are much more particular than our dogs. They seem to run into far fewer food toxins, but it's good to know what to avoid, especially if you have a kitten. And there occasionally are just some cats that like to chew on things like toxic plants, etc. in the house. Here's some of the things you should be thinking of to avoid in the first place. Avocado. It contains fruit, seeds, and bark, which contain a toxic principle known as persin. And the Guatemalan variety is most toxic. It causes GI distress. Chocolate in all forms. It contains theobromine, a compound which is a cardiac stimulant and a diuretic. The toxic dose is 2 baking squares for a 10-pound cat. The fatty foods, for sure. Our cats, they seem to be getting increasing bouts of, there's even a condition called triad disease, but we know we've got pancreatitis. We think the pancreas is inflamed. They may have inflammatory bowel disease, where it's vomiting and diarrhea, issues around, having reactions to what they're ingesting food-wise. And there can also be liver disease in combination with all of that. So you really want to be thoughtful, one, about what you're feeding your cat. So we're, You're starting to look at more protein, less carbohydrate, and the right types of fat. So not just out of any sort of fatty food. Because the last thing we want to do is trigger pancreatitis or feline triad disease. Moldy or spoiled foods. Many molds contain a type of toxin called an aflatoxin. Some of the signs include vomiting, diarrhea, muscle tremors, incoordination, elevated temperature, excessive salivation, and liver disease. Onion powder. So a small amount can actually develop anemia, but fortunately, once you stop ingesting them, the signs of anemia all reverse. Grapes. Raisins and grapes, as few as 6 grapes and raisins have caused acute kidney failure. The toxic ingredient is not yet known, and there's no known treatment. Obviously, avoiding all of those. Then gum. I'm showing this up because there's a sugar-free gum called which contains a product called xylitol, and that's the sugar-free component. Signs relate to cause a sudden drop in blood sugar. So it causes incoordination, collapse, seizures. You just want to avoid feeding any type of gum candy to your cats. For the most part, it's not going to apply to you guys, but you've got a kitten or a super cat who likes to try everything out. Just be really thoughtful of that, because it wouldn't take very much xylitol for them to have clinical signs. Tuna. Well, some tuna now and then probably won't hurt your cat, but a steady diet of tuna prepared for people can lead to malnutrition, because it won't have all the nutrients your cat needs. And too much tuna can even cause mercury poisoning. So it's another big thing to keep in mind. Occasionally, it's like most things, right? Done in moderation, okay, except for some things like grapes or maybe xylitol. But you don't want to make it sort of a substitute for feeding your cat a quality canned food. PVDs are fire retardant chemicals that can be found in high concentrations in some fish and are also found in house dust. They're known to affect thyroid function, and cat foods tend to be high in fish. There may be a causal link between hyperthyroid disease in our cats and fish consumption. There's another big thing to keep in mind. So say you're feeding your cat a canned food, which you probably should be now. Just make sure, be really thoughtful. Perhaps you don't want to be feeding him so much fish based on some of the other chemicals that are now concentrating in the fish in the first place. Soy, and really make sure your cat's food doesn't have soy in it. I mean, I did a video just about a week ago, and sure enough, I was in a grocery store. I was trying to demonstrate different things about cat food, period. But sure enough, there it was on the 3rd or 4th ingredient was soy. And it was a nice looking bag of cat food. The last thing you think it would contain soy, but there it was. And that was the primary protein source. So it's hard to even know what is soy. Is it a carbohydrate? Is it a protein? But it's a known disruptor of thyroid gland function, has no logical place in cat food. According to one study, soy was identified in 60% of all tested cat foods at a level high enough to interfere with thyroid function, which is huge. Oh, somebody's throwing up. A little bit more about supplements. Here's how to know if they're safe for your cat. There's Mischief once again. She's dressed up for Christmas. So in 2007, we had the pet food recall. Contaminated pet foods. The question is really more important than ever. As a consumer, it's difficult to know. There's a voluntary governing body called the NASC, but there is no independent regulator. First of all, you need to research the company. Visit their website. Can you phone them? Do they do independent third-party testing? This means getting the product tested prior to leaving the plant. And then, is there a guarantee that what is written on the label is in the bottle? Are they manufacturing the human grade standards? Outsource. Ingredients should be from top quality, reputable suppliers, locally sourced as much as possible. And then testimonials. Look for references from other cat owners. A little bit about my supplement, Ultimate Feline Health Formula. Our website is thecatsupplement.com. You can phone us at 888-842-9057. My supplement is third-party tested by an independent lab. I guarantee that what is on the label is in the bottle. It's manufactured to human-grade standards, and the ingredients are from some of the most highly reputable quality suppliers in the industry and are primarily sourced locally. Some testimonials from Dolores. This product truly enhances my cat's appetite. One of my old cats is a finicky eating cat. When I sprinkle the product on top of his food, he eats with enthusiasm and finishes the food. I know this is just the beginning of my good journey with the product. Thanks, Dr. Jones. Thanks, Dolores. And as part of this webinar, I'm having a big special. It's 70% off my supplement, Ultimate Feline Health Formula, for only $9.97. The regular price being $32.97 plus shipping. And plus, if you order in the next 12 hours, you're going to get 2 additional free bonuses. First, a copy of my best-selling book, Veterinary Secrets. It's being sold for $29.97. And a copy of my book, Home Diets for Pets, which is being sold for $19.97. So now what I want you to do is, after the webinar, go to theCatSupplement.com/special. A little bit about dental disease. Some of the remedies to both to prevent and treat this disease in your cat. There's a kitty who's got moderate amount of gingivitis, moderate amount of plaque and tartar. For years, maybe you've even, as a client, have been told this, that you should just feed your cat dry food to promote dental health. Yet this really isn't correct. Dry food is very firm, but it has little rubbing action on your cat's teeth. It's not removing the tartar as you'd expect. Many cats just swallow dry food. I can't believe how many cats I've seen do this. Without chewing, there's no cleaning benefit. Our cats are carnivores with teeth and jaws created for tearing into flesh and bones. They're not designed to bite down and crunch on dry kibble. They don't have flat molars. I mean, if you want to see an animal with a flat molar, look inside a cow's mouth or a horse's mouth, because they're designed to chew on hay or grass, not our cats. Well, brushing, which you've all heard about this, it just needs to be reset again and again. You want to start when your kitten is young, and at the very least, even I would even find with many clients, even once a week was beneficial. You can use pet toothpaste, or you can do something natural like baking soda is fine. I found that the electric toothbrushes were much better at getting sort of the back of the mouth, getting those back big premolars. There's a dental spray called Liba 3, and it claims the way they work, it says it balances the chemistry of your cat's mouth. And I found many guys seem to respond to it quite well. There's another product called Plaque Off. We use this a lot in our practice. It's suitable for both as well, also suitable for dogs. It's a special type of seaweed, which is found to have specific beneficial effects for oral care. It comes in a granulated form. It's rich in natural iodine. So the big point is it works great. We've actually found it work quite well. But if we've got a cat that has a thyroid condition, they can't be on it. For cats with recurring gingivitis, this is a big one. So one of the things, we'll get some of these guys get this horrible gingivitis. Sometimes we actually think it's even an immune-mediated reaction to the plaque that's on the outside of their teeth. And in some cases, the only option we had to do is talk to clients about actually removing their cat's teeth because they had such bad, this horrible gum inflammation. Unfortunately, I wasn't aware of coenzyme Q. It's a specific supplement that could be very helpful. The dose is 0.5 to 1 milligram per pound daily. So an average cat would be about 5 to 10 milligrams a day. Another product is called Propolis. It's a product of honeybees and it's an oral antiseptic. It can be also applied topically to inflamed gums. A bit more about scabby skin and hair loss. The most effective remedies that you can use right now. So why would your cat be scratching? Why does he have this loss of hair? Good question. Well, some of the obviously external signs, itchiness, constant or intermittent scratching, chronic licking, skin rashes, hair loss, bumps on the skin. 3 main possibilities: external parasites such as fleas. Food for cats, fish or milk are the most common food allergens. There can be then there are environmental allergens, so pollens to house dust mites. And in this case, you've got the immune system overreacting, causing the severe itchiness. You can start out by considering some of the topical options. Calendula or calendula in combination with aloe. I often found it worked really well. You can apply a thin coat twice daily. In many cases, you go to most of the natural pharmacies and pick up calendula or calendula in combination with aloe. Antihistamines, cats respond really well to chlortripalon. It's a conventional over-the-counter antihistamine. The dose is 2 milligrams. So typically half of a 4 milligram tablet 2 to 3 times a day. It is best to consult your veterinarian before using these medications. It often takes about 2 weeks before to see it actually helping or being beneficial. There's a homeopathic called graphites. The dose is 30C every 2 to 4 hours for 2 to 3 days. That's an acute flare-up. Rust tox is another homeopathic when there's redness and itching, which is what you see in most cases of the skin disorders. The rust tox dose is 30C every 4 hours for 3 days, short term, or 30C twice daily for 4 weeks if we're looking at more long term. A little bit about anesthesia in your cat. Why what you're being told about your cat could be wrong. It's kind of interesting. Once again, why our cats are so different. That is my former associate, Leanne, who's looks like she's about to spay a cat, like a spay hook in her right hand. The feline intestinal tract, it's much shorter than that of dogs. They're not just small dogs. Because of that, it results in a much more rapid transit of food, meaning that the food moves very quickly through your cat's intestinal tract in about 1 to 4 hours. This leads to a very important point that you and many veterinarians are not aware of. In a healthy cat, there really is no need for overnight anesthetic fasting. Even though that's what we all say, you can fast them overnight. If your cat is scheduled for surgery, there's no need for this long period of fasting. In fact, when you do that, it can make your cat more prone to a condition called hypoglycemia or low blood sugar during and after surgery. Cats that have this condition are at more risk during the surgery and can have delayed anesthetic recovery. Before I get into the next slide, you need to talk to your veterinarian about it. But in practice, we did the same thing. Dogs and cats, we had the same. I would tell the front staff to give the same directions to cat owners as dog owners. I know by the time I left, we were pretty keen on, first of all, making sure that any of the kittens, because we did a number of sort of, especially the early spay and neuter, many of the kittens are the cats that were being adopted through the animal shelter. We wanted them to be adopted, spayed or neutered. But anytime we did these young guys, sort of 8 weeks, we really make a point is we wouldn't fast them overnight. And as soon as they woke up, we offered them canned food. The other big thing is really making sure your cat is staying warm throughout the surgery. So most of the clinics they're going to have some form of heating pad. Ideally, they can have a special pump that's using hot water, but regardless, some form of heating pad that can keep your cat warm. Because those two big things really make such a difference in terms of making sure your animal is warm during surgery. They're not. That's going to really help them metabolize, not run into anesthetic complications. And secondly, to, being really aware of this low blood sugar. So if the clinic is super no, you've got to fast your cat. If it was my cat and I was to have my cat in to be spayed, say next week, if I got a new cat, I would give her food. I wouldn't take her food away until I would wake up in the morning. I take it away at 6 and that's it. I would leave her food out all night. Because I know there's no way when you take your cat, say you take the food away at 6, your cat's not going to get spayed at the very least 9 o'clock. That's lots of time for any of that food to clear her. And I think that should be more what we should be moving towards, that advice and recommendations. But, not everybody's on the same page, and many of the clinics have yet to hear of that. But take it for what you will. And if you've got a kitten, I would just be really cautious of them developing hypoglycemia. Concerned about toxic flea medications, here are some of my best holistic flea prevention and treatment options. Nasty little fleas. First of all, cedarwood oil spray. It's non-toxic, natural. It's been effective against fleas. Just be cautious in spraying any type of essential oil on your cats. Any cat, period. You just want to lightly mist them, then use a flea comb to spread it around. The one that we've used and I've had some good luck with is called Triple Sure Natural Flea and Tick Spray, made by Natural Wonder Products. Borax, it's another home treatment for flea infestations. It kills fleas by dehydrating them. So you can, especially works well on the cracks and crevices that you spread around through your house. Because the big thing with fleas and fleas building up is we're trying to prevent them from going from 1 flea to 100 flea to 1,000 fleas. You break that flea life cycle. So naturally what we're trying to do is start it with a flea comb where you're going to regularly comb your cat. I'm not sure if I have a slide on that here. because you're trying to keep the fleas down, so you don't need to jump to the sort of the big guns, the topical insecticides, such as the advantages, etc. So you're going to use a flea comb, check your cat regularly for fleas. If you see a flea, deal with it. Two, then you're going to use some of the natural products in your house to make sure don't allow those fleas to reproduce. So something like borax. Dehumidify. Flea eggs need humidity of 75% to hatch. Flea larvae need 50% humidity to survive. So in places where there's adequate humidity, a quarter of the eggs survive. In dry areas, less than 5% of the eggs survive. So then you can use a dehumidifier. You've got a really humid house, take some of that humidity out. It's going to really help go a long way in stopping the flea life cycle. So you use borax in areas. You've used the dehumidifier. Then also consider diatomaceous earth, which is safe for your pets, safe for you. It can be used on your pets as well as on ourselves. And what it is, it just looks like this fine white powder. They're digging it up out of the soil, and it comes from ages ago. There used to be big parts of the earth covered with oceans that no longer are. And what's left over is the skeletons of these little microscopic algae, and that's what we have, diatomaceous earth. So you can apply it weekly during flea season. So you can apply it on your pet, to sprinkle it on them, use a flea comb to spread it through them, and you can also apply it, in the cracks and crevices throughout your house. I used it on my lettuce to help deal with slugs. And also, people will also give it to themselves orally. They think it's considered some type of detoxifier. It'll bind things intestinal-wise, but also used for animals. So they actually think it's considered one of the natural type dewormers, is this DE or diatomaceous earth. Don't like all the vaccines. What and how many are necessary and what is optional? Good questions. No question, there is a real huge body of evidence against yearly vaccines, especially with our cats. You need to ask serious questions about the incidence of these diseases and their risk versus the reward. Consider the incidence of rabies. We've got this huge, North American cat population of 75 million. Meaning the incidence of rabies is approximately 0.003%, meaning it's extremely rare. I'm not saying don't vaccinate for rabies, but I'm saying put it in context. What is the likelihood of my cat getting this disease? I've got this indoor cat. He doesn't see any other cats. He doesn't need to be vaccinated. If you're going to so say, for instance, you've got a cat that's just 100% inside. You know what? Your cat's not going to get anything. You're not going to bring your cat disease, if that's the case. Secondly, if you've got a cat that does go outside, is in combination with other cats, okay, consider some vaccines, but really minimal vaccines. So these are the ones that I would give if I was to have a client come in and they had a kitten, and they're to say, what should I be vaccinating my kitten for? So the respiratory viruses, FVRCP, feline viral rhinotracheitis, Caleci virus, along with Panleuk or feline distemper virus. And that's it. Feline leukemia virus should only be given to high-risk cats. Those are multi-cat households, or outdoor cats with huge, large, close cat populations. The rabies vaccine, only give it at 6 months if required by law and if you need it. If you're in an area where rabies exists and your cat's potentially at risk for rabies. Fortunately, most of you guys are not in that state yet. It's required. You've got to have this rabies vaccine. Ensure that all the vaccines are given in the sub-Q tissue on the lateral sides of the right and left legs, not sort of under the shoulder blade, because the last thing you want is a big growth, which I showed you that feline, that cancer, that fibrosarcoma in one of the first slides. When it occurs up there, it's impossible to do surgery on it and remove it. I don't advise vaccines for FIP, feline bordetella, FIV, and limited use of feline leukemia vaccine in cats. My current advice is to not give the booster vaccines a year and instead just have your cat titer tested, seeing if they have immune levels that are high enough. They may not need any further vaccines. Learn as much as possible about vaccines and diseases in your area. Ultimately, your veterinarian can't make the decision for you, or should they? But it's, it is your responsibility. It is your pet. So you got to do your own background research, because they're used to saying this is what you give, this is what you shouldn't give. And, it really ultimately is up to you. If, for instance, if it's me, I know if I'm to get a cat soon, which we're looking at kitties at the SPCA right now, and if it was a kitten, I would do, my cat would be outside. I would do the FERCP vaccine, feline viral rhinotracheitis, calicivirus, and panleuk. I do it at 8 weeks and 12 weeks, and that would be it. Likelihood. I'd probably do a titer testing in a year, which we discussed, just to see where their levels are sitting at. That's probably all I would give my cat. We don't have rabies in our area, so I wouldn't do the rabies vaccine, and I wouldn't plan it unless I, for some reason, was going to go to the U.S. and that's sort of required for us to cross the border is to have our animal up to date with rabies as a vaccine. But that's it. And then for years, I would have clients come in and we would do yearly vaccine. Your cat's due for this. Your cat's due for that. And sort of as the years have gone on, I started to vaccinate less. We started to pull back on the number of vaccines. But it was just, what we did, right? That's what veterinarians did, is we send out reminders in the mail to have clients come in so their dogs or their cats could get the shots, not knowing that we're unfortunately probably causing a lot of harm. But fortunately, you guys are in the position where you don't need to be, you're more informed and you don't need to know that you don't need to have all those vaccines. A little bit more about my supplement, Ultimate Feline Health Formula. What's in it? Does it work? It's a complete vitamin and mineral blend of 25 different nutrients, including antioxidants. Calcium, magnesium, zinc, selenium, iron, copper, vitamins A, C, E, D, the host of B vitamins, B12, B6, biotin, folic acid, niacin. This is one study, the effect of nutritional interventions on the longevity of senior cats. Results from this study suggest that diet supplemented with a combination of antioxidants, prebiotic, and long-chain polyunsaturated fatty acids can increase lifespan in senior cats. There's a pretty big boost suggesting that there's benefits of supplementing your cat's diet. I have a joint support blend, which includes therapeutic levels of 3 key nutrients, glucosamine, chondroitin, and MSM. This is from JAVMA. Compelling evidence that glucosamine sulfate and chondroitin sulfate may interfere with the progression of osteoarthritis. Another study, the non-obstructive idiopathic feline urinary tract disease. This is a review article. Was stated that oral glucosamine supplementation has few side effects and long-term therapy may be useful in conjunction with other therapies in cats with chronic recurrent FLUTD, which is huge. My supplement includes prebiotics and probiotics, such as fructooligosaccharides, the prebiotics, and some of the probiotic blend. Lactobacillus acidophilus, Lactobacillus bifidum, L. rhamnus, S. thermophilus. Another study, how to manage feline chronic diarrhea. Probiotics are reported to play a role in improving immune response, replenishing normal GI microflora, and hastening the resolution of diarrhea. There's another study showing that pointing towards the benefits of probiotics. Ultimate Feline also has a key immune protective blend, colostrum, inositol, aloe vera, and maitake. There's some interesting stuff about colostrum, and this came from the Canadian Vet Journal, and the veterinarian was Craig Taylor. Colostrum is used as a nutraceutical treatment for animals of all ages to increase resistance to infection and disease caused by a wide range of pathogens, including bacteria, viruses, parasites, and fungi. It's also used for applications such as healing of intestinal lesions and increasing the absorption of nutrients from the GI tract. A whole number of benefits of colostrum. A little bit more about my supplement, Ultimate Feline Health Formula. Does it work? Well, this is best answered by the over 5,000 cat owners who have used Ultimate Feline Health Formula. After about 7 days or so on the supplement, his sneezing and nasal discharge stopped almost completely. Paula wrote in from Florida. Yes, my 2 cats love the supplement. They see it as a treat. They come running and lap it up alone before I can mix it up with their food. Thanks for making such great products. My 2 boys, thank you as well. Jenna from Trafford, Pennsylvania. Thanks, Jenna. He's moving so much better. My older cat, Picky Honey Bear, is moving so much better in the few weeks he's decided to eat his wet food with the supplement. He's back to chasing the kitten, trying hard to keep up with her. They both are doing well and loving their new routine. Thanks so much. Thanks, Andrea from Chicago. This cat supplement has literally been a lifesaver for my cat. She's 16 and in the early stages of renal failure. She stopped eating the kidney diet until I added in your supplement. She's now eating more and even putting on some of the weight she'd lost. She is a new cat, and at 16 with renal failure, this is something of a miracle. All thanks to the new supplement, and I'm delighted. Sandra from St. Peter, New Jersey. Thank you, Sandra. Well, thanks you guys for attending tonight's webinar. I hope you found it helpful for both you and your cat. And now we're at the end of the webinar. I can announce the big special. It's 70% off my supplement, Ultimate Feline Health Formula, being offered for only $9.97. Their regular price is $32.97 plus shipping. And plus, if you order in the next 12 hours, you can get 2 additional free bonuses. First, a copy of my best-selling book, Veterinary Secrets, which sells for $29.97, and a copy of my book, Home Diets for Pets, which sells for $19.97. So now we're done. Now you guys can go to thecatsupplement.com/special. And thanks for being on tonight's presentation. We have a little bit of time now too, so feel free, you guys, if you have any specific questions, either about your cat or about the supplement or some of the stuff I brought up in the presentation, feel free to post them. I'm just going to sort of scan through anything you guys have put in here to see if I can help you respond. Maria, hi Maria, I think I recognize you. Some of you guys I recommend. First of all, thanks for being on the webinar, and thanks you guys for attending all my different things. And I know I have a number of long-term clients who have sort of been on my newsletter list for. There's a few people have been on there for over 10 years. Terry said, thanks, Dr. Joan. Thanks, Terry. Oh, Shelly said you went to the website and says the special's over. Okay, I'm sure my brother Michael's going to fix that one. I would guess he is. Be my best guess. Julie says, thanks for the webinar. Is a supplement safe for a cat with no colon? Julie says, hi from Montreal. Hi, Julia. Is a supplement safe for a cat with no colon? One with diabetes and one with cancer. So Susan, was your cat's colon removed? I'm assuming your cat had megacolon, and you're wondering, could you still be on that supplement? Yeah, for sure your cat could be, and he or she should be, because you can't digest some of her food properly. You're talking about, is it safe for cats with diabetes? Yes, it is. I have a number of different pet owners have diabetic cats, and they're on the supplement. And for cancer, no question, right? And depending on the type of cancer, no question it's safe. If your cat has, you're looking at treating a cat for cancer, though, you're looking at some of the specific other supplements, then you need to be you can, no question, get on my supplement, but also look at a couple of the other specific supplements that are actually more specific with the type of cancer your cat has. What advice for a cat with asthma? So feline asthma, that's a hard one. Do we know that there's what's happened, something immune related has happened, and you've got this inflammatory response within the airways that causes the airways to sort of narrow right down. And I'm surprised how common it was with asthma. So often at these cats, the only treatment I would have cat owners come in, and for those of you who don't know what it's like with a cat with asthma, they have this. They'll come in with really difficulty breathing. And some guys, it's very, 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 very labored. So it's really hard veterinary practice. In some cases, a few guys, I had to put on oxygen. We had to sedate them at first. We looked at giving them a long-acting injectable steroid called Depo-Medrol, which isn't ideal, but unfortunately, we didn't have many other options. So your question is, what else could you give that may help with that asthmatic cat? Well, I had some cat owners being really focusing on diet-wise, like could they modify the diet in some way, because you're trying to figure out what's the trigger in the first place that's causing the airways to react. So one was diet. The second thing was much higher doses of the fish oil, the essential fatty acids. And one of the third thing we've had some different people discuss is using curcumin. It's a supplement I've discussed for many other things, also beneficial for cancer, but we know it's a pretty potent anti-inflammatory. So the cat curcumin dose is 100 milligrams per 10 pounds of body weight once a day. You can get it as a capsule. Oh, okay. I'm just gonna. Hi, you guys. Oh, there's lots of questions coming out. Okay, says. Okay. My Persian has allergies. She's on science diet, hydrolyzed protein duck. What do you think of it? It has soy. Yeah, the science diet. So I don't think it's a great food. Heidi, you're asking about the actual science diet, hydrolyzed protein. But if it's working, then I'd be reluctant to have you go off of it. And I know it probably, and you're saying you looked at it, the bag, it has soy in it. Yeah, generally, if you look at some of the, like for instance, Lisa Pearson of Cat Info, I mean, she's a pretty big critique of science diet food in general. She just thinks it's pretty crappy quality. So they're using science to break down that protein and make your cat's immune system less likely to react to what's in that food in the first place. If they're responding, if your cat's responding and not scratching or not having, then I'd be inclined to stay on it. But if they're not responding, then I'd be looking at, some of the more natural type diets, just because I know they're healthier long-term for your cat. Shelly's got a cat with advanced heart disease. I'm giving Plavix and Lasix and Alapril. Can he also take a supplement? Yes, he could. The one supplement, if you're thinking of anything, so with these guys that have heart disease or heart, yeah. There's the one drug you mentioned there's called Plavix. I'm not as familiar with it. So the couple of big things with our cats with heart, depends on the type of heart disease. Cats can get a condition called hypertrophic cardiomyopathy. So it would depend on the type based on what supplement I would have you consider. The Lasix, you can look at a natural type Lasix or diuretic is actually dandelion. So the dandelion leaf, you can also get it as a tincture. You can get dandelion. So some guys respond well to that. That's pretty safe for the cats. Okay, let's see here. Julia, you have a cat with chronic diarrhea. You've tried Tylenol powder, probiotics, special diets, no avail. Next step is fecal transplant. Wow. Well, if you've tried the probiotics, I guess I don't want to end up with another GI lymphoma. No, it's the last thing you want. Good point, Julia. That's a pretty hard. We got chronic diarrhea, and whether that's a combination of inflammatory bowel disease or is this feline triad disease, that's a pretty hard one. I'd be interesting if you're actually considering something like a fecal transplant, because I'd be interesting to know if that's going to solve your problem, because that's just still saying it's the flora, what's in the microflora, what's in the intestinal tract that are causing it in the first place. So if you can consider that, I think I'd encourage you to consider that. Aloha from Holland, Vicky says, my cat begs for the supplement at every feeding of wellness canned food. Thanks, Vicky. Christina says she thinks her cat has thyroid issues. She's lost weight. I feed her quite a bit. She loves food with tuna and whitefish. Well, I think the first thing before I suggest you what to do as far as supplement wise is just get her checked out. Figure out why she's losing weight and if she is hyperthyroid or not. And if she is hyperthyroid, just make sure that you're not make sure you review what I discussed in the webinar about thyroid disease in cats. And you're gonna have to start out with something like the least invasive is that methimazole or that tapazole. But it's so much better if you can get it transdermally, because it can be formulated by a pharmacy where they compound pill medication. They turn it into more of a paste, and then you just squirt it into the tips of your cat's ear. It's just so much less stressful for your cat, and it's such a better way to give them medication if you need to give them meds. Is a venti for kidney protection good to give your cat? Joey, I don't know what a venti is, but one of you guys here, you know what I'm going to do? Because I'm not going to get to everybody's question, but I love to. Here. I'm also going to put in you guys an email. I'm not going to get to all of your questions. I'll get to as many as possible. And I'd love to know some of those things I'd like to have a look at. Like Aventi, I don't know what that product is, so I can't respond to it. All right, so I'll put my email is. So I'm just going to give this out to you guys because you're on the webinar tonight. It's Dr. Andrew at catsupplement.com. Okay, I think I got it. I wrote it to everybody, not sure where it went. My email, Dr. Andrew at catsupplement.com. So then feel free to follow up. Okay, if you send me an email to that, then I can help you out with your specific question. How often should we feed our cats? Heidi, the thought is to feed them more frequently than not. Frequent small meals are so much better, just the way how our cats are adapted to eating, than sort of once or twice a day. Hi, April. April, nice spelling. Tanya, what age should cats start the supplement? My cat is 2.5 years. So generally, the supplement was primarily designed as a supplement for an adult cat. So anybody who's a year and of age and more be completely fine to be on the supplement. Isabel, my cat is on urinary tract disease food. Can he take your supplement? Yes, he can, and it likely will help him. But I just have a person who's friends with mine. They've got a newer adopted cat from the SPCA who's responded super well to the supplement. Who's having repeat bouts of urinary tract disease, where she strains and gets blood in her urine. They've started on the supplement, and she's done so well with it. What age should kittens start? Could a kitten start on it? They could. I'm more inclined to say let your cat sort of mature to the point where he or she is, 6 to 8 months, and then get him on the supplement. Joe, you're asking about. Sorry, and I was gonna. I think. Let's see. I'm confused. I've read that chicken is one of the reasons that cats get sick. They don't like chicken food. Also, not to use any fish, salmon flavor as well. Is this true? So, a couple points. First, it's thought that historically our cats evolved from the Middle East. I try to see where did cats first come from. They think it's actually the Middle East, and they weren't hunting. They weren't in streams and rivers eating fish. They were hunting small birds. So they're probably closer to more natural type diet as poultry, which would be chicken. I think some of the issues is if you're going to develop a food reaction, it's often to the protein source and often the thing you're fed all the time. So many of the cat foods have chicken as the main protein, and their cats, if they're going to react to something, it could be that chicken in the first place. So that's the issue. Fish, salmon flavor, I would avoid that. I agree. Thanks. Can coenzyme Q be used for heart diseases in cats? Yes, it can. Sorry, and that's the one I meant to actually get to there. I kind of got myself distracted. But yes, it can. So the issue is we know that coenzyme Q it's going to be it's an antioxidant that penetrates fatty most cells in the body. It's most beneficial for the cells in the body where there's high oxygen demand, such as the gum tissue, such as the heart tissue. So yes, it can be used. You have 2 cats with hypertrophic cardiomyopathy. Because you're kind of stuck. Like, what else can you give? You're trying to give something that could potentially help that heart muscle. So if I had a cat with hypertrophic cardiomyopathy, that's what I would get him on. That, and I would probably get him on more natural type diuretic instead of Lasix. I'd probably look at dandelion leaf. Okay, Julie said he tested positive for IBD, so that'd be why, inflammatory bowel disease. So the other thing with IBD is, so we know that something's causing all this crazy inflammation that's not allowing for the food to be absorbed properly in the first place. So it turning out as chronic diarrhea. It's going to decrease the amount of inflammation in that intestinal tract. So the other thing I read one article where someone's actually using curcumin. So the issue with curcumin, so you're looking at a cat dose of about 100 milligrams per day. Stains everything orange. You want to get it in the capsule formation, but it needs to be absorbed to be doing anything, right? So you need some fat in there. There needs to be in a canned food, or at least within something like a fish oil. And if you could, it's worth considering or trying. My vet told me that something safe. I'm not sure what that says. Ton apple something is safe, not much. Beth, if you want to send me an email, Beth, I'll try to figure out what you're asking me. VSL3, solve my young cat's diarrhea. Studies prove it works for Solomon. I'm not sure what VSL number 3 is. Feel free to send me an email. I'd like to follow up with you. Thanks, Dr. Jones. My vet is willing to do the fecal transplant and into natural alternative treatments, including traditional Chinese medicine, herbs, acupuncture, stem cells. Wonderful. Yeah, you've got a pretty open and supportive alternative vet. Good for you. Diana, any recommended supplements for my cat that has a positive for FIV to manage the condition? Diana, there's probably a number of different immune supportive ones, but every condition is slightly different. And before I say like, oh, you should go try this and this and this, try the colostrum, try the aloe, try the probiotics, I'd love to read a little bit more about FIV and how to supplement accordingly. So if you're still on here, just fire me off an email at that Dr. Andrew at thecatsupplement.com, and then I can respond to you more thoughtfully. I'm curious to see what some of the other alternative practitioners are advising. Okay, thanks for the webinar. Thanks, April. Have a good day. Thank you. You have a good night or good day too. It's good to know about coenzyme Q. You're welcome. I don't feed canned food every day. Can I mix the supplement with? What can I mix the supplement with when I don't give the canned food? You can't, but I would consider just even a small amount, like just on a tablespoon or something. Okay. Thanks. Jose said he's going to email. Jose is going to email me some questions. You bet. Okay, I will do. Thanks, Anna. Thanks, you guys. For sure. Yeah, just follow up with an email. Then I can give more thoughtful responses. Sorry, I keep banging my desk. Well, thanks, you guys, for being on the presentation. I hope you found it helpful. And I'd like to sort of follow up with some of you guys. We have some of your specific questions that I can give you more, I think, just probably more helpful suggestions of what to do next with your cats. So if you have any other additional questions, either about my supplement, about what we discussed on the webinars, specifically about your cat, feel free to fire me off an email in the next few days. I'll get back to you for sure. But once again, thanks for being on the presentation. I hope you found it helpful. I'm going to sign off and go get some supper. Thanks, you guys. Good night.